Myth number 2, vaginal estrogen is contraindicated for breast cancer survivors, among others, and increases the risk of breast cancer. You also mentioned, when we had occasion to go back and forth about this, the black box package insert. So if you would, if it's not really conflating two incorrect things, share on both for us. Thank you.
Basically, all FDA-approved products available for sale through pharmacies in this country come with a package insert, and it has certain things about the product in there. And if somebody says, oh, this is really bad, they put it in sort of like a black border box. It's a black box warning, okay? And estrogen, after the WHI was published, the results, that the FDA put a black box warning on estrogen, on systemic estrogen, basically stating all the findings of the WHI. The problem is they also put the same identical black box warning on vaginal estrogens, which were not studied at all in the WHI. They weren't studied in the slightest. There are many studies about them, but they were not studied in the WHI. And basically, there is data that shows that the amount of estrogen that gets absorbed vaginally is minuscule. And both the Menopause Society and the American College of OBGYNs have issued position statements based on data. It's not like, oh, I think this is the case. No, based on data that shows that basically they state in there that women who have breast cancer may safely use vaginal estrogens. Okay. Now they say, yes, try to use one of the non-estrogenic products first. But if it doesn't work, yes, they may safely use vaginal estrogens because the absorption is so minuscule. And so when my patients get this package insert, it's like, I'm going to die, I'm going to die. I said, no, that's not what this says, okay? And indeed, I pull out my position statement from the American College of OBGYN saying, this absorption is so low that we're allowed to use this in people that have breast cancer. Let alone you, who's even thinking about having breast cancer. So, this really is not an issue. And basically, almost every woman, now there are a few people who would be an exception, but almost every woman can safely use vaginal estrogen. And that's such an important thing because so many women do have vaginal dryness. Now, there are over-the-counter remedies, which are quite good, but some people will not get total relief from these. And that some people will have persistent pain with intercourse. And the other symptoms that most women don't think about, understandably, is bladder symptoms. And it's, my vagina is dry. Why is my bladder a problem? What are you telling me that this is related? Because the answer is that the bladder and the vagina are actually attached to each other. Okay. And when we're doing a hysterectomy, for example, we sort of have to pull the bladder out of the way so we can get in and take out the That's how attached they are. So anyway, and the tissue that lines the bladder is very much the same as the tissue that lines the vagina. And it has what we call these estrogen receptors. And when you think of receptors, sort of think like Pac-Man, going, grabbing on to, to these molecules floating around. And so the bladder has estrogen receptors just like the vagina does. Okay. And so when the vagina is getting dry, you can bet your bippy, as we used to say in the old days, that the bladder's getting dry too. Okay. Right. And why is that important? Well, it sets you up for urinary tract infections. Okay. And leakage, which I know some of our listeners may not admit to anybody, but they're worried about it. So leakage, infections, prolapse issues, things like that. And so vaginal estrogen can be very, very helpful besides alleviating pain with intercourse and dryness.
Thank you for that.